Dear President Trump, our healthcare system is broken. Data from the Centers for Medicare and Medicaid Services show national health expenditures reached $5.3 trillion in 2024, consuming 18% of gross domestic product, or roughly $15,474 per person. Projections indicate this share could climb to 18.6% in 2026 and beyond 20% by 2033 if nothing changes. Meanwhile, approximately 25 to 27 million Americans remain uninsured or face coverage gaps, according to the latest analyses, leading to delayed treatments, medical bankruptcies exceeding 500,000 annually, and poorer outcomes than peer nations, despite our massive spending. Life expectancy lags, infant mortality is higher than in many developed countries, and administrative waste plus fraud drain hundreds of billions every year. The root causes are fixable without massive new government programs or single-payer schemes that ration care and stifle innovation. Third-party payers disconnect patients from costs, creating perverse incentives for overutilization. Opaque pricing hides true expenses. Excessive regulations, including FDA delays and state licensing barriers, suppress competition and new treatments. Malpractice fears drive defensive medicine costing up to $200 billion yearly. Entitlements like Medicare and Medicaid suffer from bureaucracy, with Medicaid fraud rates estimated at 5 to 10% in some audits. The Affordable Care Act added mandates that raised premiums for millions while failing to achieve universal coverage sustainably. We need consumer-driven, market-based solutions that empower individuals, reward efficiency, protect the vulnerable through targeted safety nets, and unleash competition and innovation. This is a step-by-step plan to fix it. Implement these 10 reforms through a combination of executive actions and targeted legislation. And we can slash costs by trillions over a decade, expand access, improve quality, and restore fiscal sanity. Step 1. Enforce total price transparency immediately. Issue an executive order requiring all Medicare and Medicaid participating providers, plus private insurers via federal incentives, to post every price for every service, procedure, drug, test, and bundle in a user-friendly, searchable national database updated in real time. Ban surprise billing entirely with clear upfront estimates. Hospitals and clinics already do this voluntarily in cash-only markets and see prices drop 20 to 40% overnight as patients comparison shop. For example, cash pay MRI scans or joint replacements fall dramatically when consumers see options. Pair this with penalties for non-compliance, loss of federal reimbursements, and integrate it with existing apps and websites. In 2 years, this alone could reduce overall spending by 10 to 15%, or hundreds of billions, by ending the guessing game that lets middlemen inflate bills. Step 2, pass federal tort reform with hard caps. Work with Congress to cap non-economic damages at $250,000 nationwide for malpractice suits, limit punitive damages, impose loser pays rules for frivolous cases, and standardize expert witness requirements. This can be tied to federal funding for states adopting parallel laws. Defensive medicine, unnecessary scans, tests, and procedures driven by lawsuit fear adds massive hidden costs. Independent estimates place the annual burden at $150 to $200 billion. Texas implemented similar reforms years ago and saw malpractice premiums plummet 30 to 50% with no drop in care quality. Doctors will practice based on medicine, not lawyers, freeing resources for actual patients and lowering insurance overhead that gets passed to consumers. Step 3. Open interstate insurance sales fully. Remove all state barriers via legislation or regulatory guidance so any licensed insurer can sell policies across state lines, subject only to basic solvency and fraud rules. During your first term, you championed this. Now expand it aggressively. Americans could choose from dozens of plans instead of a handful per state, creating true competition. In states with high premiums today, prices could fall 20 to 30% as efficient carriers enter. Combine with health status underwriting protections for continuous coverage enrollees to address pre-existing conditions without mandates. Millions of middle-class families will finally afford quality coverage without subsidies. Step 4, supercharge health savings accounts for everyone. Remove all income and employment restrictions on HSAs. Raise annual contribution limits to $10,000 for individuals and $20,000 for families. allow tax-free rollover forever, and expand qualified expenses to include direct primary care memberships, gym memberships, nutrition counseling, and over-the-counter items. Offer refundable tax credits for low-income contributions. Pair every HSA with a high-deductible catastrophic plan. Evidence from employers offering HSAs shows 10 to 20% lower total spending because patients treat dollars like their own. This shifts from insurance for routine care to insurance for real catastrophes, cutting administrative waste and encouraging prevention. Direct primary care doctors charging $50, $100 monthly flat fees will proliferate, bypassing insurance bureaucracy entirely. Step 5. Block grant Medicaid with state flexibility and accountability. Convert federal Medicaid funding to per capita block grants adjusted for population, demographics, and inflation, while eliminating most federal mandates. States must cover core vulnerable groups, but gain freedom to add work requirements for able-bodied adults, experiment with managed care, premium support, or innovative delivery models. Pilot programs in states like Indiana and Arkansas already demonstrate better outcomes at lower costs. Fraud and improper payments, which exceed $50 billion yearly nationwide, will drop as states police their own budgets tightly. This preserves the safety net while saving taxpayers hundreds of billions and letting governors tailor solutions to local needs. Rural Arizona versus urban California. Step 6. Modernize Medicare with premium support and choice. Transition new retirees gradually to a defined contribution premium support model where the government provides a risk-adjusted voucher equal to the cost of traditional Medicare. Seniors choose among competing private plans or traditional fee-for-service, including expanded Medicare Advantage. Phase in over 5 years, with protections for current enrollees. Private competition has already lowered Medicare Advantage costs while improving benefits. This caps federal exposure, drives efficiency, and gives seniors real options instead of one-size-fits-all bureaucracy. Long-term savings could exceed $1 trillion over a decade without cutting benefits. Step 7. Revolutionize FDA and regulatory speed. Direct the FDA via executive order to accept approvals from stringent foreign regulators, Europe, Japan, UK, Canada, for reciprocity on drugs and devices already proven safe abroad. Shorten review timelines for breakthrough therapies to 90 days where data is strong. Expand accelerated approvals and reduce post-market surveillance burdens for low-risk innovations. Operation Warp Speed proved government can move fast when focused. New treatments will reach patients years earlier. Competition will lower prices 30 to 50% on generics and biosimilars, and American biotech will surge. Lives saved and costs reduced will be enormous. Step 8. Unleash telemedicine, direct primary care and retail health nationwide. Eliminate all cross-state licensing barriers for telehealth providers via federal preemption and reimburse at full parity in federal programs. Remove certificate of need laws that protect hospital monopolies. Certify and incentivize direct primary care practices that operate outside insurance. Retail clinics and pharmacies and big box stores should face zero regulatory hurdles for basic services. Rural and working Americans gain instant access at 40 to 60% lower cost. During the pandemic, telehealth proved its value. Now make it permanent and dominant for routine and follow-up care. Step 9. Strip unnecessary mandates and restore choice. Repeal the ACA individual mandate permanently. Roll back rigid essential health benefits lists that force unwanted coverage and inflate premiums by 20 to 30%. And authorize nationwide association health plans and short-term limited duration insurance without artificial restrictions. Limit regulations to transparency, fraud prevention, and guaranteed renewability. Families and small businesses will design plans that fit their needs and budgets, not Washington's. Pre-existing condition protections remain via continuous coverage rules and high-risk pools funded efficiently. Step 10. Reward prevention, wellness, and technology integration. Offer tax deductions or credits for proven healthy behaviors, weight management, smoking cessation, annual checkups. Fund community wellness programs and expand grants for AI-driven predictive analytics and interoperable electronic records. Require federal programs to adopt value-based payment models rewarding outcomes over volume. Only about 40% of spending currently goes to prevention. Shifting this balance will cut chronic disease costs, which drive 80% of expenditures. Implementation roadmap. Days 1 through 30. Issue executive orders for transparency, FDA reform, telehealth, and HSA expansions. Months 1 through 6. Introduce the Healthcare Freedom and Affordability Act to Congress, covering tort reform, interstate insurance, block grants, Medicare vouchers, and mandate repeals. Phase all changes over 24 to 48 months with transition funding and monitoring. Maintain protections. Expand community health centers for the poorest. Keep continuous coverage incentives and use targeted vouchers for low-income gaps. No one loses existing coverage abruptly. You're welcome, Dr. Bren Allen Jensen.